Okay, everyone, for our final series here, final chapter in WISER, what I want to go over is the tools. So there's some there's some pretty cool tools in their little toolbox here. So again, I have the toolbox icon where I can get there, or I can go up here to the explore tools. Now the chemist is also in this toolbox, but it's got a separate button up here. So just be aware of that if you go in and play around in it. And I'll show you guys that, but it's all right. There's a little bit of higher level medical stuff in there for than what I'm trained at, but for you hardcore medical folks, you paramedics and stuff, you might really get a kick out of that. So if I go to the tools, what I see is guidebooks, triage procedures, radiological tools, and then of course the chem, and then under the chem is the chemist program. So we'll start with guidebooks. The first guidebook you see is just the 2016 Emergency Response Guidebook. So here in a little bit, when the 2020s come out, of course, I think the government's kind of shut down on a lot of their stuff, so I think it probably set us back for getting our 2020 ERGs out. But we should see a update in WISER where they actually put the updated ERG in there. But if you want to use this ERG, you got several ways to identify the chemical. You can type in a name or a UN. And again, my buttons aren't working. Oh, sorry. You click and then type up here in this box. But if I want to, just go 1993 here, and it brings me up all the 1993s. If I click on it, it'll take me to that guide. Of course, it's giving me the protective distance map again, and I unhooked from my cell phone, but Bing would normally come up there, and we could play around in the ERG. The other emergency response guidebook is the WMD Response Guidebook. And I really like this guidebook because what they do is they've listed a whole bunch of WMDs. And if you look at it, there's anthrax, plagues, tularemia, smallpox, all sorts of them in here. And then when you look at the actual guide page, it breaks it down into what it is, if it's a bacteria, virus, or whatever. Wonderful to see COVID in here at some point. Gives you characteristics of it. What I love is it's got like the incubation period. So anthrax, we usually say 2 days we'd see signs and symptoms. Well, I got that out of here, right? It also tells you, fatality rate, if therapy is initiated or not. Tells you if there's treatments that we can perform. Here's some of the indicators, why would we suspect an anthrax lab? Well, we have several of these indicators, right? They give you routes of exposure. They give you some emergency response information. They give you the type of harm. They have some personal protection. Of course, it's pretty high level stuff there. And okay, that's it. That's the end of guide 1. But it's pretty good information. I always like looking at ricin. I said if I was going to be a terrorist, hey, tie all the strings up, man. Ricin is always fatal. So very limited treatment. Rate of action is 1 to 2 hours. So when you get to looking in here, you can find some pretty scary stuff. Here's smallpox. I'm not big into the etiologicals, so I actually like going in here and checking them out because this is probably my weakest area as far as categories of hazmat. So that's the WMD Response Guidebook. I think it's a nice little tool available for us. The triage procedures, I'm not going to get into these real in depth because not everyone knows how to do triage. But basically, you got the START adult algorithm, you got the Jumpstart pediatric algorithm, and then you've got a SALT triage algorithm, which is really, it was designed for big mass casualty incidents like Hurricane Katrina, 9/11, things like that. and it's really meant to supplement other triage algorithms. But I'll open the adult start, and at first you get an introduction here. If you hit navigate the chart, this is actually going to walk you through the flow chart. If you want to see the flow chart, you can click on overview, and it shows you the triage, the start flow chart here, right? So if we go back to our navigate, are they able to walk? No. Are they spontaneously breathing? No. Position airway, then observe breathing. Their apnea. Oh, we're going to put a black tag on them. By the way, if you don't know, you never want anyone to put a black tag on you or put you on a black tarp, or any black is bad, right? So if you get to your next patient, you hit start over. Are they able to walk? Yes. Oh, we're going to tag them green based on their ability to walk, but we're going to hit next here. And then it's got the secondary triage, and it helps you kind of assess your walking wounded a little better. So that's the adult triage algorithm. If nothing else, this is a nice little tool to help me kind of refresh triage, because obviously I don't get the chance to do it that much, but I teach it in various classes. So this start little algorithm is nice for me to come in and refresh. So that's the triage procedures. The next is the radiological tools. This has a ton of information in it. In fact, these 4 bullets here, you know, not the dose estimator or the unit converter, but these other 4 that are underneath it. When I realized that the Borough Hazmat team was listed as the sole resource for radiological incidents, that prompted a couple things. That prompted me to tell my chief at the time, hey, we need a lot more equipment, which he got for us, like no problem. We had that equipment within months of me talking to him. So that was awesome, but we had no protocol either. So I wrote a protocol for the hazmat team, because radiation is different. Now, we always say, hey, it's just another hazmat, you know, give me whatever, who cares? But there are some specialized protocol that you have to use when dealing with radiation. And I pretty much wrote all that out of these 4 items here. So there's some really good information. What I thought I'd show you is the dose estimator, onset of vomiting, and then the unit converter. So if I open the dose estimator, I get this. And basically what it is you put the date and time at when the exposure began, and then the date and time where they start vomiting, and it's going to give you a dose estimate. Now, obviously, if they don't vomit, you can't use this tool. But we'll plug some information in here, and I'll show you something. So we'll say today's the 8th of April, and right now it's 3:26. So we'll say at 3 o'clock, and it's going to ask you to use military time, so that'd be 1500. And one thing that screws me up is you better use a little colon in there, otherwise it won't know what you're talking about. And then we'll say everyone started throwing up at 15:20. So 20 minutes later, they started throwing up. And boom, it gives me a dose estimate of 12.96 grays. Well, what the heck is a gray? You know what? If you know and that number means something to you, my hat's off to you. I've learned radiation using the old German units, and so the gray doesn't mean much to me. But thankfully, I have our little unit converter. Now, I'm going to minimize WISER here and whatever else I had in the background so we can see these two side by side. But basically, the unit converter can convert this gray to something that we understand. So when you look at the unit converter, it's going to convert radioactivity. That's becquerels and curies. It's got the exposure. It's got the absorbed dose, and then the dose equivalent. So we're going to look at absorbed dose because that is what grays are measured in. And if you see this, it's got rads and grays. So what I can do is I can click gray because I'm going to give it a number here. and we're going to say we want it to convert from gray to something, and it'll give you all the conversions down here. So I go over to this number, which is 12.96. So I put 12.96 over here. And there it gives me a bunch of conversions. So if I look for rad, right? Well, we know that in the gamma world in particular, and even beta, to simplify things, we say, hey, look, one Rankine equals 1 rad equals 1 rem to an exterior dose. So we could easily say, look, this is a 1,296 rem dose, which is not a good dose. Let's just say these people are probably not going to make it, right? That is 60 times the lifetime dose that emergency responders should receive, and we can receive the highest dose out there. So, yeah, these folks are not having a good day by any means. But that's how you can use these two tools here. I again, they're kind of fun to play around in. You know, if you watch the miniseries Chernobyl, they talk about some dose rates they're getting in there. And I haven't went back and watched the miniseries again and plugged the information in here, but you could. And I plan on doing that when I get a spare moment so I can see actually what they were exposed to, because they were actually using international units in that miniseries. So last but not least, the chem. So the chem, if you, there's two parts in here. First of all these little drop-down lists feed into the chemist tool here. And then we have Aspire Chemical Decon. Well, if I click the chemist, basically it's a questionnaire for a patient. And it's asking, you know, state of alertness. Well, we'll say our person's normal. You know, did they faint? No. Did they seize? We'll say, sure, they seized. And they got some, pinpoint pupils. If you notice, this syndrome prediction is changing. And the syndromes down here is there's an opioid syndrome. There's a pesticide syndrome. What do you think's in there? Yep, that's nerve agents. We have an irritant gas syndrome. We have a knockdown syndrome. We have a convulsant syndrome. And so basically what this is going to allude to is, hey, you know, you have like if you look at the pesticide syndrome right now we have a very good chance that based on our signs and symptoms, what this person was exposed to is a pesticide. And by knowing that, it will determine what kind of medical treatment we want to give them. So we'll finish the questionnaire and see how it plays out. I'm going to try to make it pesticide syndrome so I can show you the care for it. But going back, it says sweaty. We'll say can't assess. Mucous membrane. We'll say we can't assess that either. Heart rate. We'll say they're tachy. Low blood pressure. Yes. Burning nose or throat. Sure, why not? Wheezing, no. Shortness of breath, we'll say yes. Hyperventilation, we'll say no. Wet lungs, we'll say can't assess. Burning chest, can't assess. Irritated burning skin, can't assess. Eye irritation, dizziness, we'll say sure on the dizziness. So basically we're done. And it gives you a little thing here, you know, like, hey, remember, when you're doing this, be uphill and downwind, right? Isn't that what it says? Okay, it should say, remember to locate yourself uphill and upwind. So we'll see how long it takes to figure them out that they're telling us to stand downwind, right? It talks about, hey, remember that terrorist attacks often include a secondary event. Tyler hates the word secondary. He calls them additional events or additional devices. Because if you say, oh, there was a secondary event, it doesn't really mean it's the last one, but kind of alludes to that, right? So there's just some reminders there. If I go down and I look at my syndrome prediction, the best syndrome we have here is a pesticide syndrome. So if I bring that up, here is the patient care stuff. And again, I'm not going to get too nerdy into this. I'll let you guys go in and look at it on your own. But it's got the nerve agents, acute patient care. I'm sure it talks about the atropine and 2-pam chloride in there, or at least atropine. You got in the first few minutes, you got initial event activities, patient management, all that good stuff, right? So that is what the chemist looks like. And I think it's a fairly good tool. I just haven't played around it enough to really value it a lot. If I go back to the tools, though, I do want to show you the Aspire Chemical Decon. So the PRISM guidelines for Decon, again, it's going to ask you for some information. How long ago in minutes were the casualty exposed? We'll say, hey, they were exposed 60 minutes ago. Is the identity of the chemical known or not? If you click yes, it's going to ask you to put in a name, a UN or NA, or a stick code or something. I'm going to say no. And when I say no, then it says, okay, well, can you estimate the volatility of the contaminant? If I say yes, it gives me this bar, and it's like, okay, how volatile is it? Well, if it's a gas, it's really volatile. If it's something like diesel, it's probably way down here, right? And notice they give you examples there, like light oil, heavy lubricating oil. So I'll just kind of stick it somewhere in there. Actually, diesel is probably more of a light oil. So we'll stick it down there. Now, if you look, it says, hey, basically, you're wasting your time if you're deconning the people after 1,238 minutes, right? So it's just saying, look, this is where you got to get after these people, is somewhere between the exposure time and 1,238 minutes. Now, if I had a more volatile chemical, you can see that this number here is going down, because obviously the chemicals should be evaporating off the people who were exposed. So that's all it's really doing, is telling you, in fact, like acetone here, if we're trying to decon them 60 minutes after they were exposed, essentially we're not deconning much, because the acetone should be gone and no longer a problem. Now, obviously, this is temperature dependent, like all evaporation. So if we were running this algorithm at 0 degrees, this 42 minutes probably wouldn't be very accurate. It'd probably be a lot more than that. So I'm sure it's based on 68 degrees. Now, if you should do decon, if you see this little blue decon required, and it's got a hypertext hand, if I click on that, it brings it up to this PRISM guidelines. And so there's different categories here, like patient requirements, communication, patient management, evacuation, so on and so forth. They got emergency decon. But what I wanted to show you was the technical decon. So basically, there's not a lot of super detailed information in here, but it does give you an idea of what your decon should look like. So it talks about shower water temperature between 95 and 104 for a 60 to 90 seconds, right? And you can use a mild detergent in the shower water, and the provision of a washcloth for each patient. So again, this is really geared towards patients and not towards us. But again, it's another tool where I could see a lot of the tools in WISER where I could see them super valuable is on the planning side, to understand how we're going to react to a prominent chemical in our area. We can run different scenarios through here. We can look at decontamination recommendations, and we can look at, chemists and look at the treatment for whatever syndrome that chemical can produce. So a lot of good stuff in here. And I think that about wraps it up. That's all our tools. So we went through the chem, the radiological, the triage procedures, and the guidebooks. So just one more thing to say is I really hope that anyone watching this, you know, if your work allows it, take your work laptop, throw this program on there. If you're in safety, like I am, you'll probably find yourself using WISER a fair amount during your normal operations, just to look at, you know, a new chemical that comes to your facility or something like that. If you're not in safety, but you belong to a hazmat team, like the borough hazmat team or a fire department, you know, get in here, download it on your personal computer, play around in it. I am by far a power user. I'm really just showing you guys what I know about it, how I use it. So please, if you find something out about this program that I missed, leave it in the comments in the virtual classroom there, and I'm definitely still learning this stuff myself. All right, well, that concludes WISER.